It's day 79 of the coronavirus pandemic in America. And as the death toll in the U.S. and around the world continues to rise, a disturbing trend has emerged. More men are dying than women. Today, an ER doctor on the front lines is revealing the shocking differences she's seeing in her male and female patients. And the virus hunter, Dr. Ian Lipkin, is returning. He's going to reveal what you need to know about this gender disparity. But first, here's the latest. Boris Johnson, the Prime Minister of Great Britain, fighting for his life after being rushed to the ICU just 2 weeks after saying this.
The coronavirus is the biggest threat this country has faced for decades.
And back in the States, a grim day for New Yorkers.
5,489 New Yorkers have lost their lives. That is the largest single-day increase.
Plus, a major medical group, the American Thoracic Society, endorses hydroxychloroquine, suggesting COVID-19 patients with pneumonia get doses of the anti-malaria drug. This comes as the U.S. death toll surpasses 10,000. Scientists have noticed a trend. More men are dying from coronavirus than women. It's happening in China, South Korea, Italy, and some places here in the U.S. In Michigan, men represent 59% of deaths. In Washington, 57%. In New York City, 63%. The big question, is it a matter of behavior or biology?
There are actual differences in the ways that immune cells respond in men and women.
Today, we investigate. Women's bodies, it turns out, may be better at fighting off infection thanks to their hormones and their two X chromosomes.
Female immune cells may respond faster and more powerfully to viral attacks by producing higher amounts of interferons. Those are proteins that stop viruses from replicating, as well as antibodies, which neutralize the invaders.
This is also true in the animal kingdom. With birds, females show higher antibody responses to infection than males. And with certain species of monkeys, apes, whales, and lions, females outlive males. Scientists now say the differences between how men and women respond to coronavirus could provide a vital clue in the search for a cure. Not every state is releasing the breakdown of their coronavirus cases and deaths by gender. But in New York City, America's most devastated hotspot, we know that while men make up 54% of the diagnoses, they currently account for over 60% of deaths. I wanted to speak to someone in the middle of the epicenter, a New York City ER, to get firsthand observations from the front line. Dr. Kadrea Jackson is an emergency medicine physician at Mount Sinai Morningside. She joins us now via Zoom. Dr. Jackson, how surprised have you been by the number of male COVID patients you've seen compared to the number of women?
Well, initially when we learned about COVID, we thought there would be no disparity between sex, that it's more of elderly patients that are affected more. But from what I've seen in our emergency department, that is clearly that there is a significantly more male patients that are coming in. And especially those male patients are usually sicker than our female from the female counterparts.
And again, so I'm clear on the age range of your COVID patients. Is the gender disparity true for all ages?
The gender disparity seems to be more evident in the younger population as the patients increase in age, as they get to in the 70s to the 80s, it seems to equal out more, but definitely stands out more in the younger patients, that there seems to be more young males that are coming in.
So one theory, as you know, has been that maybe men are waiting longer than women to turn to doctors for help. Has that been your observation as well?
That has not actually been my observation. I think, and I'll be honest, I don't think we know exactly the cause of why there's this disparity at this time. But when the males, when I talk to them, when they come in, they're sick and they come in as when they feel when they have symptoms. And it's not that women are staying home or handling it better, but everyone seems to, when they're not feeling well, they're coming into the hospital.
Dr. Jackson, thanks to you and your colleagues for all the hard work you're doing. I want to get famed epidemiologist and virus hunter Dr. Ian Lipkin's insight on this. He joins us now via Zoom. When this trend was first observed in China, some pointed to social factors, like the fact that nearly half of all Chinese men smoke compared to 2% of women. And here in the U.S., there was a study that showed men were particularly bad at washing their hands properly. So, Dr. Lipkin, could more men be dying because of behavioral differences like these?
It's very difficult to disentangle the sex-specific effects. More men smoke than women. Men have different types of exposures. Many men don't take as good care of themselves as women do. But there also is a sex-specific effect that we see prior to menopause, which means that women respond better to vaccines. They also respond better with infectious illnesses of different types. That difference between men and women disappears after menopause. It appears to be associated with estrogen.
Well, let me share this theory because it's fascinating me with the audience. This is an idea of why COVID-19 may be hitting men harder than women, and it has to do with our genetic differences. While men have X and Y chromosomes, as you all know, females have 2 X chromosomes. Now, why does that matter? It turns out the Y chromosome is like nothing, right? It should have been an X to truly be powerful. And because the X chromosome contains important immune system genes, having 2 could theoretically give women a big advantage. So don't mock those mom genes. Another big difference between Mars and Venus, by the way, is that men produce more testosterone while women produce more estrogen. So Italy is one of the countries keeping track of diagnoses and deaths from coronavirus based on gender. Now, we know they found that male deaths were twice as high as females. In France, reportedly 60% of their fatalities are male, and in China it's 64%. So how important is it, Dr. Lipkin, for the United States to begin tracking more clearly male and female differences and make those numbers public when gender is concerned?
We are tracking these kinds of numbers, and as they come in, I'm sure they will be released. The question is, what are we going to do with this information? I don't think, for example, that we're going to recommend that men start taking estrogen. I mean, this is just something that's part of our biology and what makes it different.
So, Dr. Lipkin, you've been a pioneer in the use of plasma, convalescent plasma, taking the serum, the antibodies from people who've already recovered from COVID-19 and using them for others. What are your hopes for this cutting-edge idea that's actually quite old?
We're hoping for a few things. We're hoping that by giving these antibodies to people in the form of the plasma, we're going to be able to protect healthcare workers, close contacts of people who've been infected who don't yet have disease. And we're also looking forward to seeing whether or not it can change the course of illness. As you know, Boris Johnson was doing extremely well, and then he had a relapse and he became much more ill and wound up in an ICU. People like that might benefit from plasma therapy. It's going to require a controlled trial to ensure, however, that it does have that effect, because sometimes we make predictions about something that might be helpful, and it turns out to be the opposite.
So how does it work? If you give antibodies from someone who's recovered to someone who has never seen the virus or just saw it, how does it help them beat it back?
The idea is it's almost like giving them a passive vaccine. Instead of giving them some piece of the virus and having them make a response to it, which then results in antibodies that attacks the virus, you give them the antibodies that they would have generated if they themselves had received a vaccine. So it's an accelerated process of generating immunity to the virus. And we're cautiously optimistic that this is going to work.
And before we go, are you today concerned that our pets might pass it from one person to another?
I am concerned, but I'm concerned for 2 reasons. I'm concerned for the pets and the fact that this may lead to people abandoning pets or mistreating pets or euthanizing pets. And I'm also concerned about the risk. But there are ways in which you can minimize that. You wash your hands after you pet your pet, right? If your pet is also distancing with you, as you yourself are distancing, then this is not an issue because they're part of your family. So there are many reasons to be concerned about this, but wildlife are a different story. And there's a group of veterinarians who are now looking at the possibility that COVID might be transferred to native bats in North America. We don't know whether this is going to be feasible or not. Again, my concern would be that people might say we need to wipe out all bats. If we did that, not only would it be a horrible thing for the bats, but in addition, bats control insect populations. They're also pollinators. So everything that we do has ramifications. So we're focusing a lot on treatment. The plasma stuff is going really well. The plasma trials are moving forward, and we're optimistic on that. But we really need to push forward with vaccines.
And plasma, again, taking the antibodies of people who have recovered and putting them into deathly ill individuals who can't make their own immune response. Dr. Lipkin, thank you very much for your leadership. Coming up, what former CDC Director Tom Frieden says is the next step we need to take right away to stop the spread of coronavirus. Be sure to subscribe to my channel so you don't miss anything. And remember to check back often to see what's new.